On Wednesday morning, Hudson County View sat down with Stacy and Debbie of the 2 Degrees Foundation, an organization looking to bring education and awareness about stillbirths here in New Jersey. Debbie Vijay of Maplewood and Stacy Didberg of Kearny established the 2 Degrees Foundation earlier this year, 2 years after the New Jersey legislature passed the Autumn Joy Stillbirth Dignity Act, named after Vijay's stillborn daughter. The bill was signed into law by Governor Chris Christie in hopes of establishing more sensitive policies and procedures to handle stillbirths, as well as to establish protocols in evaluating fetal deaths in New Jersey. The National Health Service defines stillbirth as a baby born dead after 24 weeks of completed pregnancy. Right now, stillbirth is very taboo. Nobody wants to talk about dead babies, Didberg told Hudson County View.
I think right now stillbirth is very taboo. And, nobody wants to talk about dead babies. But the rates are ridiculous. It's 1 in 7.
One in New Jersey. It's approximately 650 stillbirths a year for the state. And nationally, it's approximately 26,000 babies every year. That's 71 babies every day. And I think that if you ask pretty much anyone who has suffered a stillbirth, if they knew that if there was ever a chance of it happening, everyone would say that they never even heard of it, or that
it was something that happened to a friend's friend.
Right, or it happened, I mean, quite honestly, like when I had suffered my stillbirth, I never even knew what one was. I personally had thought, and I think I'm a relatively educated person, I thought it was something that happened during labor. I mean, I never even fully knew. And I had suffered 2 miscarriages prior to losing my daughter, so I felt like I knew that there were risks. I knew that bad things happened. I didn't know that this was one of them.
She also explained how the 2 Degrees Foundation came about, with Vijay later adding the organization strives to provide comfort to families that have endured the same struggles they have.
Well, Deb and I share the fact that we both are stillbirth moms. I lost my daughter Ryan when I was 37 weeks pregnant, and Deb lost her daughter as well. And we connected on that level. So our partnership is more than just business. We're angel moms, and we connect well.
Get the word out there and be a place where other families who are suffering a similar loss and know that they can reach out to us, know that they're not alone. I think that's one of the most important things that I would want to get across anyone who suffers a stillbirth, is that you're not alone. It's an extremely isolating experience. It's very lonely, and you feel like you're 1 in a million when unfortunately you're not.
Didberg also noted that she believes there's a lack of support from healthcare professionals in the state that handle stillbirths.
The lack of support from the system in regards to doctors and nurses, social workers, and that's one part that we really think needs improvement in New Jersey. Having an outlet to make decisions such as whether or not to have autopsies, whether or not to hold your child. I was very lucky in the fact that I did hold my daughter, and it was probably one of the best things that I had ever decided in my life.
Feel more comfortable talking about stillbirth with their patients and their expected moms, and expected moms being made aware and empowered with information about why stillbirths occur and what they can do, then I think that it's a win, because at the end of the day, maybe there's a chance that we could actually save someone's life.
Vijay concluded by stating they don't want to elicit fear regarding the subject of childbirth, but that the 2 Degrees Foundation just wants expecting mothers to be informed.
At the very least, I don't think Stacy and I or anyone affiliated in the stillbirth community wants to be scaremongers in any shape or form. We just want there to be a dialogue around stillbirth, and people know that it happens, and that they have the power to go to their doctors and talk to them about their concerns, and that it's okay. It's okay.
I'm John Heides with the Hudson County View, the eye of the community.